Welcome to Stanford Institute of Nursing. Get ready for an exciting series where we tackle over 5,000 next-gen Nclex questions. Join us in each episode as we delve into the essential topics you need to know to pass your Nclex exam quickly.
Let's start with our first question. What is the best position to place a newborn after nursing to prevent sudden infant death syndrome? Option A, supine. B, sideline. C, faller. D, prone. So here, condition given is SIDS, which means sudden infant death syndrome. So question is about the positions, means what kind of position we have to give the child to prevent from the SIDS. So let's solve this MCQ. Okay. So firstly, we will discuss about the SIDS. SIDS stands for the sudden infant death syndrome, which is a disorder marked by the sudden and unexpected death of healthy child who is younger than 1 year old, usually during the sleep. So we can say that here SIDS is suspected when a seemingly healthy infant is found dead following a period of sleep without any sign of the distress, etc. Usually the SIDS is idiopathic, which means having no specific cause. And it is also called as the crib death. Okay, so here basically it can be occur up to the 1 year of the child to 16 month. Okay, means 1 to 1.5 year is the age period for happening the SIDS, but the peak risk of infant is 2 to 4 months. Then here about the SIDS, we know that there are some specific, any specific cause, means it is idiopathic, but there are some factors. We call them the risk factors that are responsible for the SIDS, and these factors may be like the respiratory distress, okay, then the low birth or the premature babies, low birth weight baby or the premature baby, then babies sleeping on their stomach, okay, and overheating, etc., or the unsafe or old crib. So these are some specific risk factors of happening the SIDS. So we know that there are some specific measures that we can prevent baby from the SIDS condition. So here, firstly about the positioning. So I'll tell you about some basic measures about the prevention of the SIDS. So basically, there are the two specific positions we can place the client to prevent from the SIDS condition. So first one is the supine or lying on back position, and second is sideline. So placing the baby on his or his back to sleep both at the night and the day naps. So here supine or the lying is the best position to prevent from the SIDS, and here the sideline position is also helpful by using some other methods like fringe surface should be used in the bodies of the babies, and breastfeeding, you prevent overheating, all these. But here the question is about the positioning. So here two positions I'll clear you to prevent the SIDS. First is about the supine position and second is about the sideline positions. And if these research shows that a specific sleeping position can reduce the occurrence of SIDS. So here we know if the patient, like the baby will sleep, for example, if the baby will sleep on the prone position or on the stomach, then it will lead to increased risk of suffocations, and that lead to the death of the baby. Okay, so prone or the on the stomach position should be avoided. So basically two positions here that are recommended by are APP. APP stands for the American Academy of the Pediatrics. So these two positions are, first one is the supine or the lying back and second is the sideline position. So here right options will be option A, supine position, and option B, sideline. And these positions are recommended by APP, and APP stands for the American Academy of Pediatrics. This is the best methods or the best positions for the patient, for the client to prevent the SIDS or the sudden infant death syndrome. Fowler position is inadequate in case of the infants, and prone position or on the stomach position, on the stomach lying position is inappropriate because this position can increase the risk of suffocation, okay, due to decreased arousal. So prone and Fowler position both are the inappropriate options. So right option will be A and B. Question number second is here. What are the potential causes of the primary insomnia that the nurse should consider when assessing a client with this diagnosis? Select all that apply. So here this is a SATA based question. So let's see the options. A option, excessive caffeine. B, chronic stress. C, severe anxiety. D, environmental noise. Chronic depression. Generalized pain. So basically it is the question about the insomnia. And mainly asking about the causes of primary insomnia. Means we have to find out about the causes. We have to select causes that are related to the primary insomnia. So before solving this question, we have to some basic knowledge about the insomnia here. So let's see insomnia. So what is insomnia here? Insomnia is a sleep disorder in which you have to trouble falling or staying asleep, and the condition can be short-term, acute, or can long-lasting, chronic. It may also come and go. So basically see here, like here, insomnia means inability to fall asleep. Inability to fall asleep or the staying asleep. And this condition can be short term, means it may be the acute condition or it may be the long lasting, the chronic condition. So how can we differentiate in the acute and the chronic? Acute insomnia will less than 1 month, and chronic insomnia episodes more than 1 month. So this is a differentiation. Acute will be the short period of the insomnia and chronic is the long lasting period. which can be more than 1 month, and in acute, the episodes of the insomnia less than 1 month. So here it is a differentiation about the acute and the chronic. So you can see here like few weeks and insomnia and the last than the 3 month or the more. So this is the basic introduction about the insomnia. There are the two main causes of the insomnia here, primary and the secondary causes. So let's have an overview of the primary insomnia and the secondary insomnia. So primary insomnia is the most common form of the insomnia, which has no clear underlying causes. This is a sleep problem, but there is no medical or the psychiatric cause. It is likely that the sleep problem is result from the maladaptive behavior of the learning. So means in the primary insomnia, there will be no any medical or the psychiatric cause. And in the secondary causes, secondary insomnia is related to some medical or the psychiatric causes. See here, like the sleep apnea, restless leg syndrome, circadian rhythm disorder due to the night shift work, various medical substance abuse, and emotional problems. So here, both are the different here. So main concern is about here is about the primary. So we can see that some primary insomnia causes. It can be due to like some conditions like stress, maladaptive behavior of learning, then here about the noise, some environmental conditions, caffeine use. So all these are the some primary causes. Means here in primary cause of the insomnia, primary insomnia causes here like no any medical or the psychiatric history. So means there are some causes I have explained you, or the factors like the stress, maladaptive behavior of learning, noise, environmental condition, caffeine. All these factors will be responsible for the primary insomnia. So let's see about the some main causes here, like the caffeine abuse, caffeine use, like the noise pollution, excessive stress or the chronic stress. So firstly about the caffeine. So caffeine acts as the adenosine receptor agonist, and adenosine is a substance we all know that in our body that promote the sleepiness. So caffeine block this ARA, means adenosine receptor antagonist. So you can see here like the caffeine block this adenosine receptor antagonist, and when this receptor will block, that cause the no sleepiness. So it is a specific cause of the primary insomnia. First cause, that is caffeine use. Second here, that the noise pollution. So we can call that the noise, environmental noise or the noise pollution, such as the air, vehicle traffic, has shown to the view increase the stage 1 sleep and decrease slow wave and the random eye motion sleep. So nighttime noise may also cause view source extra production of the hormones such as adrenaline, cortisol, as well as the elevated heart rate and the blood pressure. So we can call that the noise pollution, excessive noise in the environment. So if there will be excessive noise, it can directly put a bad impact on the sleep. And here lead to poor sleep cycle. So second cause maybe are basically the noise pollution here. Then third cause here about the extreme stress. So extreme stress, like We know that the stress and anxiety often lead to insomnia and the sleep problems. Lack of the proper rest can also contribute to the stress, since the stress and sleep problems, such as the reciprocal relationship, understanding and addressing one of these issues, can often lead to improvement for other. So sometimes the stress here, we know all the stress when we're not able to cope up with the situations or the cope up with the problems, then we can call the particular situation that is a stress. And there are some daily stressful activities like the relationship stress, job stress, education related stress. So all these factors, contributing factors, can lead to the insomnia. So here, like, be influenced by the mild or the moderate stress, and stress related insomnia may manifest as the some mild stress, such as the persistent thought or the rumination during the night. Means person will not able to fall asleep because the thoughts will come again and again in the mind of the client, and that extreme situation or the chronic stress or the acute stress related to directly put impact on the individual sleep and cause a primary insomnia. So here, this is main some factors. Now let's come to the right options here. So right options, we know that excessive caffeine, A option is right. We have discussed, because caffeine directly block the adenosine receptor antagonist, and when the caffeine directly block this receptor, so patient will not able to fall asleep, because the adenosine receptor uh, can help to the patient to go for a sleep. So it block the ARA and lead to the insomnia. So right option A. B, chronic stress, I have explained you, like the stressful activities related to the job, study, or any relationship can put a bad impact on this our like the sleep cycle. And stress related insomnia may manifest as the mild stress, such as the persistent thoughts or the rumination during the night. So B option is also in a right option here. Then D option, environmental noise, we have discussed here, like how the noise pollution can lead to the insomnia. So these options are the right option here. And here, like, generalized pain is not a appropriate or the right answer here, because it is a medical condition. And we know that the primary insomnia doesn't include any medical or the psychiatric condition. And chronic depression is also a psychiatric condition. So here two conditions like the depression or generalized pain here. These all the conditions are medical and the psychiatric conditions. So primary insomnia is not influenced or not enhanced by all these condition here. So these both are, or C option is also inappropriate, because the severe anxiety is also a psychiatric condition here. So all these are the remaining three options are not appropriate related to primary insomnia, because these conditions are related to the secondary insomnia. So these will not the inappropriate options here. So option A, B, and D will be the right options. So that's about the two condition here: sudden infant death syndrome and primary insomnia. So that's about the today's question. Thanks for watching me.